food is over there. Over there. Pizza's over there. What? Excuse me. Okay, so I cannot find, I was looking for the psych meds, like for an assignment with Purdue. I had to create like a Excel document with all of the medication. Maybe it's in here. The classes, the pathways, the side effects for each medication. And I was trying to see if I could bring it. Someone asked me a question about the medication, a little cheat sheet, and I took it to, used to take it to clinical sites with me, and I think this is analgesics, antidepressants, but I don't think this is mine. No, I think this is a list for potentially harmful drugs in the elderly, the Beers list. That's not it. I do not know. I had it in a binder. I thought it would be easy to find, but it's not. It's not. So I was saying for you guys to text me or call me and ask me any question that you guys may have, and I will answer it on my live. And I think that's what I'll be doing from now on, versus me in the car taking you guys on a ride with me to my to see my members, because I can't respond or I can't look at the chat or whatnot. So I'd rather be able to look at the chat. So I was thinking maybe once a week I'll do do this, and so you guys can like send me text messages through the week or whatnot, and then I can answer the questions, or you guys can call me 248-842. Oh no, or text me, because calling me, then I'll have to get off. So I have to get another phone. But just ask me anything that you guys have, any questions. Look what I found when I was looking for. Oh, here's Aiden.
Can I see?
Yeah, it's just my cap and gown that I ordered for the graduation for Purdue. And I didn't go to graduation. It's funny, like every time he get on here, his hair is messy. Y'all will swear I don't do his hair, but this is a new style from the last time, and it's due.
Hi.
I usually braid it on Sundays. Okay, what are you doing, Aiden?
Saying hi.
Okay.
Hi. They can't hear me or not?
Yeah, they can hear you, but you can't hear them. Okay, put this down. Okay. Aiden, back up. Go ahead. Mommy is talking to the people. Go ahead. Go finish your food. Okay, so maybe I never even opened it. I didn't go to graduation. I didn't walk, and I didn't even open it. And this cost, I think, like $400, $300 some dollars. I might do a giveaway. The Tesso regular branded black gold. What size is it? Does it not have a size on here? I don't know. There's no size on here, but I probably got a large. I'll probably do a giveaway for this instead of letting it go to waste or whatnot. I don't know. Hi, thank you. Nana Love Jesus said we look great, Aiden. Say thank you. Say thank you, Nana.
Thank you, Nana. Thank you,
Nana.
Me.
She can't see. She typed it right here. She typed it on here. Yeah, so anyway, wasted some money. I was just so excited to be graduating, and then someone was like, let's go, and I was like, okay, and I didn't go, but I ordered it. So anyway, so let's talk about the first question I asked. Wait, the good news. So I am in the program right now, a 6-week program, and I am going to start a podcast. I am going to start a podcast. So I'm so excited about that. Um, I've been thinking about it, starting a podcast, and I was just on YouTube, on Instagram, and something popped up, and they were talking about spilling their knowledge or whatnot to people for free. Um, and so, to make a long story short, I was going to, hey, Roslyn. So, to make a long story short, I was going to, uh, have someone do some work for me. And they were charging me such and such amount. And so then, my guy, his friend ended up saying he can do the work or whatnot. So I wouldn't have to spend that money that I was going to spend. So I'm scrolling through IG and I see an advertisement about a podcast or whatnot. So I signed up for it because it's something I've been talking about. Was I thinking about doing it now? No, but it was something I was thinking about. So I signed up or whatnot, went to the Zoom class or whatnot, and they spilled some jewels, of course, but they didn't give everything. So, of course, nothing comes for free. So they wanted you to sign up. And so I was like, oh, I was going to spend this money on this, and then I didn't have to spend it. So why not spend it to invest in myself? So that's what I did. So it's a 6 week class, and so we have these mentors or whatnot, and they just teach you everything about starting your own podcast or whatnot. And so they're like, why not? Some of you guys got YouTube channels, and you've been advertising and talking about companies or whatever for years, and you ain't getting paid for it or whatnot. And I'm like, yeah, I've been doing YouTube for years. So, and I don't know what you got to do to get paid on YouTube. Like, you guys know, I don't really know too much about YouTube. I don't do any editing or anything like that. I just get on here and share the knowledge that I have. And I don't really look for any kickbacks or anything. I don't ask you guys for anything. People always say, put your cash up, pin your cash up or whatever. Not so, I want to thank you and give back or whatnot. I'm like, no, that's okay, and all that or whatever. Like, when I come out with merch and stuff, then you guys can pay me back that way by, supporting me that way. And so therefore, I don't know, is it 5,000 followers before you can start making money with YouTube, or do you have to reach out? Like, I don't know how none of that works. So the blog, it's like you can reach out to companies and come up with some agreements or whatnot for you to advertise them on. Let me see. So the purpose of this is so I can interact with you guys. So let me read it. Kristen says, grateful that I bumped into your videos a couple weeks ago and decided to sign up to get my BHA at Capella. Okay, congratulations. And I got a lot of videos out there, and I try to make it super simple. I haven't been to Capella, so I know a lot has changed, but I'm still thinking that my videos that I put out there are informative and can help you a long way. Nana loves Jesus. I'm proud of you and can't wait to listen to your podcast. Still on the fence if Purdue is where I'm going for my NP. I'm a bit nervous and need guidance like the forest need rain. Okay, so we're going to talk about that too. So that's what I wanted to share with you guys. I am going to start a blog, and I'm excited. And so people that's been wanting to know how you can give back, how you can say thank you or whatnot, just, subscribe to my blog and tell all your friends and family about my blog. And thank you. That's how you can repay me. Um, so that's the blog I want to share with you guys. And then I don't know how I'm gonna do this giveaway or whatnot. I'm gonna think of something for this cap and gown that cost me like a lot of money. So I just found it when I was looking for the psych drugs. So first thing first, someone texted me and they were saying, asking me about my job. So I told you guys, if you're interested in working doing the health risk assessments, I have a recruiter who will get you started immediately. Originally, I said that you had to be a FNP, family nurse practitioner, but I soon found out that you can be a Psych NP, long as you have assessment experience on your resume. And if you went for family or you went for psych, part of the curriculum was assessments. So you've learned assessments. So especially if you're a new grad, but it doesn't matter if you're a new grad or not. Just, I'll give you guys my number again, 248-842-2662. Just let me know, text me, let me know you're interested and in doing the health risk assessments. For those that don't know what the health risk assessments are, then I did a few live videos or whatnot, so you can watch the videos where I say go with me to work or whatnot. But it's basically just going to members' homes and doing health risk assessments for insurance companies. So it's just asking questions, going over their medication, making sure they know why they are taking their medication, and just asking them health screening questions such as any heart problems, lung problems, muscle issues, circulation issues, any preventative care that they've got, just generic questions like you guys do, most people do on an intake. So it's really simple. I love the job. It's no changing wounds, it's no patient care, it's none of that. So it's like I love it. So as I said before, if you're a new grad or you're going to graduate soon, if you're currently at a job and you're not happy there, but you're like, this is where I've been for years, so I may as well stay here. My opinion, I suggest that you go out and you explore different jobs. Have a full-time job. I got another message here. Christine says, I'm currently a utilization reviewer and save manager at a health insurance company. Okay, case manager. All right. Well, that's good. Do you like it? I seen utilization reviewer when I first started out looking for a job or whatnot, and it just seemed like it was a lot. But I liked it because it was remote, and I really wanted to do it, so I applied, but I didn't get any any callbacks. So, and a case manager at a health insurance company. Okay. What do you do as a case manager at the health insurance company? Been doing it for 13 years. Okay, good. So I would suggest to have your full-time job with your benefits or whatever, and or a part-time job, or work whatever you have to work to get the benefits if you can or whatnot. And then go out and do different things and get your feet wet and until you figure out what it is that you really love doing. I tell people all the time, we work this hard to get where we are today. We shouldn't be working a job because that's where you've been for a long time, or that's where you're comfortable, but you're really not happy there. Try to find a job that you love. And I love doing the health risk assessments. Like, I am going to do health risk assessments until I start my own business. That's just that. Like, I don't I, I just like, just watch my videos on the health risk assessments. So I'm not going to go too much into that, but I love it. Find something you love. At least when you say you go to a med spa, do that for 6 months to a year. Get that on your resume. If that's not what you want to do, keep it moving. Find another part-time job. You want to do cardio or something. Get your experience. Go do 6 months to a year. Get it on your resume. If that's not what you like, move on. Just continue doing things part-time just to see if you love it until you find out what it is that you really love to do. Because as you get older and you work harder to elevate yourself, like I said, you shouldn't be doing anything stressful. Like I told a friend of mine, if I wanted to stay stressed out and irritated, then I would have stayed a CNA, I would have stayed a LPN, or I would have stayed a RN. Like, I elevated because I wanted something where I had more autonomy, I made more money, less stressful. So I don't think you should be elevating yourself to do something that's stressful just for the money. It's careers out here that you can have where you're doing it because you love it and you're making good money. And with the health risk assessments, I'm making good money doing that. Christine, review the cases. Meanwhile, the patients are in the hospital. DC planning, authorize anything the hospital may request, etc. I deal with Medicare patients. Okay. All right. Well, that sounds not too bad. That sounds good. So that's that. So if you have signed on with the company that I work for already, and you've went through watched the onboarding videos, and you went to some of the seminars that talks about the role, then I don't want you to get discouraged, because when you're out there in the field, the videos, when I was watching the videos, I was like, oh no, what? That seems like a lot. And I was just like, I don't know. I don't know if I could do this, or we'll see if I like it. So once you get out there in the field, it's more relaxed than you think. Someone said that they were saying something about reporting issues. If you don't report things, then to the CPS or something, then it's your license. Well, I'm here to tell you, I really haven't seen anything that needs reporting. So that there may be a stretch, reach, or whatnot, or maybe someone has dealt with that, but I haven't dealt with that. So I wouldn't really put too much. It kind of scares people when they hear people say it's your license, it's your license. But at the end of the day, I know it's my license and I'm going to protect my license. So I'm going to do everything to my best ability and professionally, where I don't have to worry about jeopardizing my license. So if you see something that needs to report, it's not hard, report it, call CPS and report it. But I've not had a situation where I feel like it was something that needed to be reported. You know, some people houses you go in and they have a lot of animals. Some people have rats for animals, but they were in a cage or whatnot. But I mean, don't clean up, like they should when they have animals, and and you walk in a house and you barely can breathe. That's not all, but some people, everybody is not clean. So, I mean, that's the most I've ran into, but I can't report that. Hey, they didn't clean up after the animals. They didn't clean up before I came to their house. Like, I haven't ran into anything that needed to be reported. So, when you hear people, don't let people just say that and then it just turns you off about the job or scare you away from the job. Always go out. And that's another thing. So with schools and jobs or whatnot, everybody has their own opinion. And that's why I research everything before I make a commitment to it. And if some people have an opinion, I'll get it or whatnot. But most of the time, I don't deter from a a school, a job, or whatever, based off of what somebody say, because like somebody might say, oh, this school was too hard, too hard. Well, it may be hard to you. What's hard for you may be easy for me. What's easy for me may be hard for you or whatnot. Safety and the clinicians ask about security. Let me see what this say. Oh, I lost it. Hold on. Oh, the safety of it. Someone just texted me about the safety. Adult. I don't know. Can someone do health risk assessment? What? You know what? That's a good question, Nana. I have to write that one down and see if adult geriatric. I have to ask him. I don't see why not. You really doing assessments with adult geriatric. So I think it's all about if you have assessments on your CV. Long as you have that on there, then I believe so, because that's what they're looking for, that you have experience doing assessments, which we all do. So I think that's why they changed it from psychiatric nurse practitioners can't do the health risk assessments, or they have to have 2 years of family experience, because at the end of the day, they realize everybody does assessments. I don't care if you're in peds, geriatric, family, whatever, we all do assessments. So no, nope, not only uh, PAs also. So this, for health risk assessments, you have to be a doctor or a physician. No RNs. You have to be a physician, a physician assistant, or a nurse practitioner. So that's that. But so I got a text message talking about the safety. So if if you're doing a health risk assessments and you feel unsafe for any reason, you do not have to complete the assessment. And you don't have to call the company and let them know that you're not going to complete the visit. There is a button there where you can just click on I did not feel safe. That simple. They're not going to call you about it or anything. If you don't feel safe, it ain't nothing to talk about. You don't feel safe. So they get that. So I'll talk about my issues. I had two incidents where I didn't feel safe, so I didn't complete the visit. One was I went to someone's home, and the ex-girlfriend, lived in a driveway in a trailer home. She walked me into the house so I couldn't tell the condition of the house because when you walk in, the side door, it had a blanket. So, people sometimes put blankets in between the door and the kitchen or whatnot, because that was the next step up the kitchen. And they prevent the air from going in and out. So once I got past that blanket, it looked like the house was abandoned. It was horrible. Um, she walked me to the man, and he was in his room. I'm talking about filthy. And he was in there in his underwear, I believe, or some shorts or something. And he was on a bed with no sheets. He just had the plastic. And it was just a mess. And she's like, okay, when you get done, we can talk. You can come talk to me about about him or whatever. He's stubborn. He doesn't like to go to the doctor, whatever. So I'm like, okay. I'm thinking like, okay, it ain't even nowhere here I don't even want to sit down. So that's when I had purchased a tripod. And that's what I would suggest too. If you're doing health risk assessment, go on YouTube and order a tripod that's big enough to hold an iPad. Because some places you don't want to sit down, and some people who live unsanitary think it's normal. So it'll be a spot available on the couch for you to sit down with little stains that look like it could be animal piss stains or something, and just covered with hair, animal hair. And the house just reeks of urine and whatever. And they'll say you can have a seat. So if it's a house like that and they have like dogs and cats or whatnot, I just like kind of scan around, see if I see little rodents or bugs or whatnot. If I don't, then I'll just stand up. They say have a seat. I'm like, oh, I've been driving all day. So when I get to the homes, I like to stand. That's where I got my tripod and just stretch my legs. So that's what I'll do. But this house in particular, it was just like, I know a bed bug is going to jump on me at any point. So I have to get out of here. And so I'm like, what medications are you taking? And he's like, blood pressure or whatever, tell me the medication or whatever. And so I'm like, you have any breathing problems? You have any heart problems, chest pains, blah, blah, blah. And he's like, no. And I'm like, okay, you're all set. That completes our visit. And then I go back outside, and then the ex-girlfriend comes, and she was like, oh, that was fast. And I was like, oh, it was just a quick visit. And in my head, I'm like, excuse my language, if you don't get the F out of my face before I slap you for walking me into that home, and you knew the condition of that home, like, get out of my face, lady. Like, I was like, So when I was in there, he was saying that his grandson moved in with them, and it was a big dog too in that house. And it was like little toys around also. And so he's like, my grandson moved in, him and his girlfriend and their 2-year-old daughter. And I'm thinking like, it's a 2-year-old that lives in his house. I knew I seen toys, but seriously, if that was enough, I heard a newborn baby back there crying. You guys have a newborn baby and a 2-year-old living in this filth. So these children are going to grow up to think that this is normal, and they're going to be, that's just sad. But anyway, so I hauled ass out of there, met her in the driveway, like, oh, it was a quick visit, blah, 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 and put it in notes and said, hey, didn't feel safe. That was my other job with the health risk assessments. So this one, I went and I went up in the Flint area. And when I put up, they had a Confederate flag so big it covered half the house. And then on the other side of the house, it said Trumps and guns. Now I'm fine with Trump and guns. If that's who you want to vote for, that's that's what you want to do, I'm fine with that. But the Confederate flag that big, I said nope. And so I said I did not feel safe. I'm not going in. I'm not going in. So if you don't feel safe, then don't go. And when I first started, I'm thinking like, oh, I'm going to have to go to Detroit. It's going to be all the grandsons at the grandma house sitting on a porch with their pants sagging and the guns showing, and they going to be flirting with me while I'm trying to get up to see grandma or whatnot. But it's none of that. So I haven't went anywhere where it was like anybody there, like, and I'm always surprised, like, ain't nobody here with grandma, grandpa, or whatnot. So it's really safe. I would I wouldn't be doing anything unsafe. So I have my little baby, but I love my life. I'm not doing anything unsafe, and I wouldn't share this if I thought that it was unsafe. And like I said before, this is like the company caused them to verify that the company caused to set up the appointment. They have all their information. They know it's the insurance company. You call them. If they're a little smart, they know GPS. It's on the iPad, on your cell phone. So I don't think none of these people are out to kidnap you or do any harm to you. The only thing I say to people is, like, if you have a schizophrenia patient member, and it'll have, like, you can see like their diagnoses or whatnot. Oh, no problem, Sandra. So you can see the diagnoses or whatnot. And if you don't feel comfortable going, oh, that was another one. I called a lady and said, I can't find your address. And so I always call and let them know that what time I'm coming. Then I call them again when I'm on my way. So she had a diagnosis, some mental diagnoses or whatnot. Now, I'm not going to discriminate against people and not go to their homes because they have a diagnosis, a mental, that's just discrimination. So I called her. I couldn't find her house. And luckily, I couldn't find her house because I did not want to complete this visit after talking to her on the phone. She's trying to tell me where she lives and all the stuff. But then she goes to say, be careful when you're coming up because those people out there, they stole my identity and went to the dentist, and they're watching me, and yeah, she was like paranoid or whatnot. So at that point, if I could have found the house, I wouldn't have did the visit, because if somebody is having an episode or whatnot, it's really not going to be easy to do a health risk assessment, because they have to sit down, you have to do vital signs, and you have to ask questions. So at that, I would have just said I didn't feel safe, and you don't really have to say why. You just say you don't feel safe. If you want to put why and put a reason in there, you can. So that's that. Let me see. So I couldn't find my psych drug list. So I would suggest those of you that are looking for an easy way to remember psych drugs, I would just do like a little spreadsheet or something, and just either you got depression, anxiety, PTSD, paranoia, schizophrenia, bipolar, what else is it? Whatever I would do, like write a list of the medications, I mean, the diagnoses. And then I would Google the common drugs that are prescribed. So, and that's not basically what we do because it's 1,000 drugs, but it's only so many drugs that we prescribe. And if you're in a clinic, then it's really a limited amount of drugs that you prescribe. So if you're in a clinic, you're not getting the real sick people. You're not getting the paranoia, schizophrenia. You're not getting those kind of people, you might get borderline or whatever, but you're going to get depression, anxiety, borderline, bipolar, people with insomnia. Those are the most common that you would get in a clinical field. Now, the other ones that you have to the really sick people who are hard to treat, where you have to use multiple drugs or whatnot, they're going to be in inpatient psych, or somewhere like Rose Hill, where they have a community and a program to get people with mental illnesses to a level where they can function in society. So you're not going to get those people. So you're going to be using SSRIs like Zoloft, Zoloft for depression, anxiety. You're going to be using Paxil for anxiety and depression. You're going to be using Prozac for anxiety, depression. I think Prozac is also for OCD. You're going to be using drugs. You're going to be using like the SSRIs. Those are like the most common ones. And you're going to be using like trazodone for sleep, and you can use it for depression. You're going to be using Bramron for depression, and for appetite, off label. You're going to be using bipolar. You're going to be using, so bipolar, you can have depression and bipolar. So you're going to be using you can't give SSRI with someone with bipolar and not give them a mood stabilizer. So with like bipolar, you're going to be using like something like Zoloft for depression, and you're going to be using like a mood stabilizer. Mood stabilizers could be Depakote. What else? Valproic acid. Why can't I think? But you can Google those drugs, those mood stabilizers. So in a clinic, basically, you're going to use an SSRI, mood stabilizer, and benzos for anxiety, panic attacks. Those are the common drugs that you'll use in a clinical site. SSRIs, analytics, benzos, mood stabilizers. So just Google like the common ones that you would use. And then some patients you'll have to use an antipsychotic. So I would just Google antipsychotic, common antipsychotics, common mood stabilizers, common SSRIs, common benzos, and that'll get you. So when you're going to your clinical sites, though, you need to be writing down what the doctor is prescribing. So, and then like my preceptor, he would just say, he would really stop and educate us and say, hey, these are the common drugs in this order is how you would prescribe them. So you really, when it comes to drugs, you really need to pay attention. And for those of you that's in school, and you're just passing the medication, I wish I would have listened to my LPN teacher when she said, when you are passing medication, learn. I didn't think I was going to go this further for, where I'm prescribing medication in the beginning of my career. I thought educational career, I thought I was just going to get my bachelor's and open up a SENA school. But God has something else, planned. So I ended here, dual certified psychiatric and family nurse practitioner. And then now he's saying, move on to starting the podcast. So, like I said, you always have a plan, but at the end of the day, God has your life mapped out. So anyway, so I didn't listen to my teacher when she said, when you're passing the drugs, know why what the drug is for. Like when I was a LPN, I was passing sertraline all the time, and I never knew what it was. And a lot of the old people was taking it. Sertraline and Zoloft. And I'm thinking, because a lot of old people think taking it, I'm like, oh, this must be a dementia medication. And I never looked it up. And it's an antidepressant or anti-anxiety medication. You can use it for that too. And I never knew that. So if I can give you guys any advice that's still in school, still working as an LPN or RN, passing medication, know what the drug is for. Know what it's for. Okay. So that's that. Schools. Someone asked me about, they're on the fence about Purdue or whatnot. So the only schools I went to, which was Excelsior. Well, I went for my LPN. Went to Toledo. So that's just that. But for my RN, I went to Excelsior. For my BSN, Capella. For my So of course, those are schools that I suggest. Now, when I was looking at Purdue, as you guys know, I researched like 15 schools before I choose which ones. I was torn between Purdue, University of Phoenix, and Arizona State, all online, except for the clinical portion. So Arizona State, I was not able to go to because they didn't take Michigan students. Phoenix, Arizona, I was not able to go to because, as you guys know, I did the ladder program from the kid dietary to LPN to RN, BSN, and I didn't stop. So therefore, once I got my RN license and my BSN, I really didn't have that much experience as an RN. So therefore, I was not able to go to Phoenix, Arizona. Why did I pick Phoenix, Arizona and Arizona State? Because they didn't have an accelerated program. And you guys know that I love accelerated. But they didn't have accelerated programs. So, but I didn't care because I think it was a traditional 20 months, 18, 20, or 24 months. I didn't care. I was going. Know why? Because their program was like under 24. One of them was either 22 or 24,000, and the other one was like 20,000. So I was going to one of those. So versus Purdue, like 42,000 or something like that. And all the other schools that Walden, Davenport, all the other schools, Madonna was way more. All the other schools average the same cost. So I picked Purdue, and I recommend Purdue. But then, so with these teachers, the same with Capella, you never know what kind of teacher you're going to get. You get some teachers who love teaching, want their students to be successful. Rosalind, hello, says your sound went off when you were listening to schools. Oh, can you guys hear me now? Stop, Aiden. Aiden, stop. Can you guys hear me now? I'm just gonna wait until somebody. Yes. Okay. Thank you. So, Josephina, thank you. Okay. Thank you, Sandra, and thank you, Nana Loves Jesus. Did you eat your pizza? Let me see. Let me see the plate. Let me see. Thank you, Rosalind. Oh, you were eating your food, huh? After you finish that one, then you can have some fruit snacks.
Oh, I can't do that.
Okay, well, you had like 10 packs of fruit snacks, and you had like how many packs of Oreos?
Yeah.
No, are you telling a story?
One.
No, you had more than one. So no more fruit snacks. Remember I said no more fruit snacks? When I gave you the last one, I said that was the last one, remember? Okay, so no more fruit snacks. Okay, stop. If you're hungry, finish the pizza. Okay, so now I'm busy right now, right? Okay, so let mommy do this in peace. Okay. So he doesn't have school tomorrow, if you guys wondering like why he isn't in the bed. So anyway, the schools. So I go back to the schools. So Aiden, you can't bounce that while I'm doing this. Sorry. So the schools that I narrowed down were Arizona State, Phoenix of Arizona, and Purdue. So Phoenix, I picked Purdue, and the reasons were so Phoenix of Arizona and Arizona State. Arizona State did not accept Michigan students, so that was out. Phoenix of Arizona wanted you to have a certain amount of clinical experience as an RN. And as you guys know, I went from dietary, LPN, RN, and I didn't have any experience with BSN, but I really didn't have any experience with any clinical experience as an RN. So not the hours that they needed. So, okay, so let me go back and you guys, because you guys probably wondering like, why didn't you have experience, the hours? So I was working in home care and as an LPN. So I got done with the RN program, and I was still doing home care. And once I got done with the RN program, I went to Capella and I got my BSN in 8 weeks. So I didn't have enough hours on a clinical site to qualify for Phoenix, Arizona. So that's what happened. So I couldn't go there. Their program was not accelerated, but I still was going to go there. I think their program was like, 18 to 24 months or something. But I didn't care because of the price. The price was, one of them was like 21,000. I don't know. Let me wait a minute because the sound probably went out because I got a phone call. I think that's what happened the last time. Okay, can you guys hear? Can you guys hear me? Go call D on your iPad. I can hear. Okay, good. So, yeah, they were, one of them was like 20,000, and the other one, and I think that was Phoenix of Arizona, and then the other one was like 22,000 or something like that. So I'm like, oh yeah, I'm going there. I don't care if it's not accelerated, if they don't have accelerated program for the cost, that's where I'm going. So if you guys can, if money is a factor, or you want to pay out of pocket, whatever the case is, Phoenix, I didn't go there, so I don't know, but for the price, Phoenix, Arizona, been around forever. I think that was probably the first online school ever. But check those out if the cost is an issue. And so I picked Purdue, but Purdue was around $42,000, and every other school that I researched was about the same. So I went with Purdue. So yeah, I definitely, oh, this is what I was going to say. So with any school, just like Capella and within Purdue, any school I went to, you have the teachers who really care and want to see you succeed and will do everything to make sure you succeed. And then you have the ones that really don't give two shits. You know, they teach in a class and then they trying to get their check, and that's that. So, with that being said, if you're going to do these online classes, you have to make sure you're self-driven, because you may not get Sandra says, sounds like Purdue is more feasible. Yeah. So you may not get a professor who will put in the work and make sure you succeed. Like I had one at, I hadn't gotten a C since community college. Well, since I taught myself the RN program, for those of you that don't know, when I went to Excelsior, I had all my prereqs from a community college. So all I had to do was do their 7 or 8 core classes. And I didn't do it online. I didn't have a teacher, a tutor, nobody. They just sent me I had to download this outline, and they said this a lot of people was using Achieve or whatever, but that was just a rip off. So they'll give you this outline, and they say these are the books we recommend, and these are the classes. Here's the outline. When you feel like you're ready, find a testing center and go test out. You can test out. So that's what I did. So I taught myself the RN program, and I taught myself enough to pass the NCLEX. Now, I will say that I got all C's in each class. I got all C's, but it's okay. C's get degrees. And I taught myself. And I went and took the NCLEX and why would you do that? Somebody might be on here, screenshot my card number and go shopping. I'm just playing. I know y'all wouldn't. Y'all so sweet. Y'all let me know, like, hey, erase that lie. Your son had your debit card in the screen. So, anyway, so stop, Aiden. So, what was I saying before he almost exposed my card? Josephina said hi.
Hi.
Say hi, Josephina.
Hi, Josephina.
So what was I saying? My brain. I was saying, what was I just saying?
Here.
Yes, it is.
Hold on a minute.
Jesus, I'm getting notifications from my email of all these payments. Thank you for your payment. Thank you for your payment. Automatic payments. That's why I probably can't think. Aiden, stop. about what I was just saying. Teacher's paycheck. What about teachers' paychecks? Oh. I was getting C's. I got testing out, yeah. So I got C's out of each class. And I taught myself well enough to go sit down for the NCLEX and only had to answer the minimum amount of questions and pass on the first try. So what was my reasoning for letting you guys know that? What was my reasoning for letting you guys know that I taught myself the nursing program? The reason I was trying to tell you guys that, I don't know, but I did. It definitely wasn't a brag. It was to freaking back it up with something. So anyway, the bad teachers. Oh, so I thank you, Nana Love Jesus. So yeah, so you have to know how to. You have to be self-motivated, self-driven. Those two things mean the same, but you have to be well organized, and you just have to understand that I'm going into this program to learn and teach myself. Just in case you get a teacher who, this is what I was saying. So I had a teacher who tried to fail me, and she had gave me a C for an assignment, and I hadn't gotten a C since Excelsior when I taught myself, is what I was saying. So, I went into Purdue from Capella with a 3.98. So I'm like, a C, like why are you trying me or whatever? But she just was those teachers that, didn't really care or whatever. Roslyn Abanquan, I hope I said that right. Self-driven and motivated enough to study hard and smart and pass each course in the NP program, pretty much. Yeah, within yourself, just in case you have one of those instructors that really don't care. So most of them did care, and that's really the only one I had an issue with that tried to fail me. You're not getting fruit snacks.
I did eat it all.
No, you didn't eat it all. Even if you ate it all, you're not getting any more fruit snacks, because the last one I gave you, I said no more fruit snacks, because you ate like 5 packs. And you ate the whole box of Oreos in 1 week. Get down. Do you want to go to the dentist? If you want to go to the dentist, I'll give you a pack of fruit snacks. And when I get off of this, then I will I'll schedule a dentist appointment for tomorrow.
No.
Well, you'll get a pack of fruit snacks. Go get the fruit snacks. You can have the fruit snacks.
No.
Why not? You said you wanted fruit snacks. Go get the fruit snacks. Eat a pack of fruit snacks. Eat 2. And I'll just set a dentist appointment, because that's where you're going to end up.
No, I don't want to do that.
Okay, well, no more fruit snacks, or you're going to mess your teeth up and end up at the dentist. You think mommy just saying that just to be mean?
Yeah.
I'm not. I don't want you to have to go to the dentist, and you don't like the dentist or your daddy. He saves you from the dentist, right? Okay, so if you want fruit snacks, I'm cool with it. But we're going to have to go and get those teeth cleaned at the dentist. So you make the decision. All right, sorry. So yeah. But Purdue is doable, and both of the no matter what program. So the Excel part was just like, if you've been to Capella or you heard about Capella, the Excel track is just writing papers. And so that's the same thing with Purdue, the Excel track. The first part of the first 10 weeks is writing papers, writing papers. And then just like any other school, you have the RUD. You have the discussion, weekly assignment, discussion, and you may have a quiz or whatnot. Pretty easy. There, it becomes repetitive, and I mean, yeah, and you just like, oh, that's what you get tired of. You're like, oh my God, the same assignments, the same assignments. So when I went from the family and I went to psych, it was set up the same way, and of course different assignments because Nana loves Jesus. With God's grace and your great advice, I literally graduated with a 4.0 from Capella. Yes, and it's doable. I got a 3.98 because I had 2B assignments that I had in the beginning, and I didn't think the assignments would get easier. I thought they would just get harder. So I'm like, I'm not doing these assignments over. So that's another more advice that I have. Just do the assignment over, because the instructor tell you exactly what they want you to do to improve the paper. So it's super easy to get an A. So I'm having a distraction come in. Aiden's dead. My boyfriend, he is a distraction. So I might have to end this live. But anyway, what was I going to say? So that's it with Purdue. And I have a lot of, that's why I can't wait to get my office. Like this setup here is right in the dining room, the kitchen over there, the living room. I just need to get my addition built. So, Josephina, let me see. Covarubius. I hope I said that correct. Because of you and your videos, I am starting May 6th. Thank you so much for doing these videos. Oh, no problem. I do these videos because when I was going to Excelsior, before I chose the school, I was YouTubing for a real person to give some advice. And there was only ambassadors, so I didn't get any real advice. So I started the YouTube channel so I could give advice, and students or prospective students wouldn't have to go through what I went through. And if someone was out there and they would have told me about Excelsior, like had reviews about Excelsior, I probably would not have went because that was the waiting period for the clinical sites, and that you had to go to out of state. It was just ridiculous. But no, there was no one on YouTube except for the ambassadors or whatever they're called, where they speak all good things about the program. And I'm like, I'm about to tell people the real. And so that's why I started this channel. And you're going to do Purdue or Capella? This is YouTube live, so please watch what you say. Oh, okay, with Capella. I miss Capella. I'm going to go back to Capella for my DNP if I decide to do it. So I may do it just to, I don't know. I'm thinking about it.
Your mommy new glasses.
Sandra, we appreciate your transparency, Angela. Thank you. No problem. No problem. Anyways, what are you doing? Why are you looking at me like that? You're distracting me.
Because I'm super Aiden.
I'm talking about your daddy. It's easier said than done. Once you go from Capella writing papers, a whole bunch of papers, then you go to Purdue writing a whole bunch of papers again. Like, it took me 3 weeks to start with Purdue, because I didn't I was like, what was I thinking? Why didn't I take a break? It was just like, I love Capella. Nana loves Jesus. I love Capella. They told me I can't do the adult geriatric nurse practitioner because of the flex BSN I did with them. What? Because we didn't bring it in. Ashanti.
What?
Are you starting a podcast? I missed the beginning of this live. Yes. Yes, I'm going to start a podcast. Yes. I'm excited about that. I started this 6-week program.
Close up.
So yeah, I'm going to start a podcast. So yes, I heard someone I just talked to on the phone, Rosalind, I think, was telling me that she got her MSN with I think education with Capella, and they told her you can't get 2 masters at the same school. Now that was new information for me. I did not know. So so now if you have if you did the BSN with them. So I love Capella. They told me I can't do the geriatric NP because of the flex BSN I did with them. What does the BSN have to do with MSN though? That's weird. And then with Purdue, I guess it's different because I got the MSN and and then now they call it the Psych NP post certificate. So flex path, and I took 3 master classes from that. Okay.
How do I spell super? How do I spell super? Daddy?
He's taking the trash out. That's I would be heartbroken too.
How do I
But
spell super?
so as far as the DMP, where I'm not doing a DMP right now, I just really don't have the energy to start back going to school. And I don't need it with their contract. That's what Rosalind was telling me. That's weird. Reese Peanut Butter Cup. I'm interested in where you work as an MP. I'm okay. Intrigued with the flexibility. Okay, so just text me, and after this live, I'll contact you. 248-842-2662. Ashanti, I can't wait to tune into the podcast. You are very inspirational. Thank you so much. So with the podcast, I'm like, okay, I got to figure out a name. I'm thinking like, I want to have nurse practitioner in there, but I also want to use the word. I don't want to use these words, but I've always been authentic. I don't want to be the real MP or the authentic MP or anything like that. So I'm trying to find an adjective that doesn't sound so corny. So if you guys think of a good name, text me 248-842-2662. Just text me like, hey, this is such and such, and I think this is a good name. And maybe I'll pick one of y'all names. I don't know. Maybe y'all can help me. I don't know. So I'm thinking I'm gonna invite like different people in different fields as an MP or whatnot. No, it's not gonna rain, is it?
And just know that you have other people here we including your shit.
Oh God, you're welcome. So anywho, so I'm just right now just trying to figure out my career. I was gonna put them in the dishwasher and save them. I'm trying to figure out my career right now. And I don't know when I'm gonna go back to school. Would you please stop? Oh, I know, just stop.
He can't stop. He can talk to you.
No, he can stop.
I am the girl, but I'm not a real. I'm not a teacher. I am super boy.
Yeah, you're a super boy. I like that.
You're not a super girl. I'm a super guy.
So I'm going to figure out my career. Oh, this is another thing I'm going to do. Because so I'm not giving y'all this advice and not going by it myself. When I say do different things and figure out what you like, I mean that. So I'm going to go to a Botox class, and I'm going to learn Botox. So in my because I don't know where I might go. I don't know if I'm going to I don't know what the Lord has planned for me. So I just want to get experience. I don't know if I'm going to open a med spa. I don't know if I'm going to open a practice. I don't know. I'm just going with the flow. And the flow says podcast, and another flow says Botox. You might do a med spa. You guys know that I'm a cosmetologist and a massage therapist, because when I was in cosmetology school, the plan was to open a med spa. So I went to cosmetology school, graduated, immediately went to massage therapy school. So I don't know. I keep my license up to date because I just don't know which way I'm going to go. But I'm going to go in whatever I love. And I'm going to keep doing health assessments until I figure it out. Nope. Can't bounce the ball, Aiden. So,
What you mean?
because if he bounced the ball, then it's going to be, and the sound is going to be messed up in the video.
They get it. You live a real life. They get it.
So anyway, I'm going to do the boat. They come here in June for the Botox training. I'm going to do that. I also have in my Amazon cart, I have a face, a Botox book, and so I can kind of teach myself Botox before I go to the training, so I can have some type of experience. Can RNs do health? Alora Yanis, Can RNs do health risk assessments? Or yeah, only nurse practitioners, physician's assistants, and providers. Physicians can do health risk assessments. Yeah, sorry, but it'll be here when you get done. I think the health risk assessments are here to stay.
So you gonna feed me?
So that's that. So I talked about the schools. I briefly talked about the psych drugs. I talked about
How do I spell hero?
watching the videos, the onboarding videos with the health risk assessment
Hero. H-E-R.
training.
Oh.
And don't let that discourage you. Don't let what people say, it's your license and you have to do that. You, like I said, you're not running into anything that you have to report to CPS or anything. And to be honest, if I seen anything that I had to report, I wouldn't have a problem reporting it. So that's that.
H-E-R-O.
So what else did I want to talk about? I don't think nobody texted me any questions. Nope, I don't have any questions here. I don't have any questions. Do you guys have any more questions?
I need to talk to you.
Can you stop because they can hear you?
I need to talk to you. I'm serious. I got questions.
Okay. If your voice gonna be in the video, you might as well come and say hi.
I mean, I'm boiling eggs for dinner. That's what I'm doing. I'm boiling eggs for dinner.
Anyway.
Tell that.
But I almost started to call out the school, and that's not even my son. Aiden's fine. That's his dad tripping. So I had the school fever. Like I started, as you guys probably can tell, is I love learning. Hence, I'm learning the podcast. I want to do the Botox. And a couple weeks ago, I was like, I'm gonna call Capella and get started in this DNP program. I was just feeling it. And then I don't know what happened. I didn't do it. And I just came up with other things. But eventually I'm sure I'll do it because I just like to elevate myself. So we'll see. All right. I see a few people just joined. Do you guys have any questions before I get off? So I will keep you guys posted about the podcast. And that's very exciting. And then Nina Loves Jesus. Are the 6 classes, the prereqs, pretty doable? Prereqs. So I didn't have to do any prereqs. Not with Excelsior, not with Capella, or Purdue. And the reason is, when I first decided I was going to go to school to be an RN, to get my bachelor's, I was just going to go to a 4-year university. And so I researched like 15 schools, and I wrote down the common prereqs that everybody wanted. And so I went to a community college because community colleges where some of these schools now are doing the prereqs for free through Sophia. So I don't know. But I went to a community college and I took all the prereqs. So I don't suggest statistics online. You got to go to a community college for that. Some of you guys may be super duper smart, or maybe you can do it if you don't do 8 weeks, 6 or 8 weeks. If you do 12 or 15 weeks, then maybe you can do it. But if you do accelerated, then no. But anyway, I did all my prereqs at a community college because my plan was to go to a 4-year university. So therefore, when I went to Excelsior, I didn't have to do any prereqs. And none of the schools I had prereqs. It was just the core nursing classes. They said they are part of the program. What classes are they? Because what they do is they build your prereqs into your nursing program. So, let me see. Are you talking about the pharmacology and the assessment, and what was the other one? Pharm, assessment, and but you're talking about aren't you talking about which one? Nana, patho, thank you, Sandra. Patho, psychology, not psychology, patho, assessment, and pharmacology. Are you talking about those at Purdue, or are you talking about you are? Okay, yeah. So those classes, they weren't bad. They're doable. And 2 classes at a time is doable. I did 2 classes at a time, and I still work. I worked at doing the home care. So I didn't do any. I worked midnights, and I didn't do any homework there. So, and I did 2 classes and worked 3 12s a week. So yeah, it's doable. My hair was nice today, but I walked to pick Aiden up from school because I'm trying to lose a little weight, and my hair poofed up. Distraction. Anyway, so yeah, it's doable. Whoosh. That's why I can't wait to get my audition built so I can be in my room. In a room.
Light fine, be nice looking. Light fine doing in that tent.
Yeah, okay. All right. Any more questions about anything? So I think I'm going to do this once a week. And I'll talk about my progress with my podcast. I'll talk about the job. Whatever I have to just talk about. We can just sit and kick it. And you guys can just ask me whatever questions you have. You guys can text me questions throughout the week. So when I jump on here, I'll already have the questions and I'll address the questions. And I like to have the questions ahead of time and answer them on a live because I'm sure it's more than one person that have the same question. So if you guys don't have any questions, you guys can just log off and I'll just watch the amount of people in here. Because I hate to just log off. Madeline. I think so. How's homework? What is homework like? Thanks for this podcast. You finished 2 classes before 10 weeks. Do they allow you to take another? So no, with Purdue, it's just 10 weeks. And some teachers let you, so let me go talk about that. Some teachers let you submit your assignments as soon as they get done. Sandra, I think F&Ps are more marketable, so it's good that you.
You ready for the talent show?
Okay, so yeah, it's a lot of benefits for the dual certification, especially with me saying, you know, get your feet wet and do 6 months to a year in different fields, part-time, just to figure out what you want to do. And yeah, you can just, you're more marketable, dual certified. But to be honest, if I had to do it over again, I would have never got the FNP. I would have got Psych and the DNP. And the reason being, the reason I say that is because medicine, you're dealing with so many organs, so many parts of the body. It's just a lot. Whereas in psych, you're just dealing with the mental. So you're just focusing and trying to become an expert at just the mental, not the heart, the lungs, the brain, the sinuses, the muscles, the liver, the kidneys. It's just too much. The phantom pain. It's just a lot. So, but I got it. And it's the reason, I'm sure it's the reason that the Lord led me to get it. So, but if I had to do it all over again, I probably would not have done family. And the reason I didn't do psych first, is because I thought as a psych nurse practitioner, you have to sit across from a table, you have to do therapy. And I'm like, I don't really want to listen to people problems all day and take that home with me. I got enough that I have to deal with from my past. So I'm like, I didn't want to do that. Didn't want to be sad or anything when I got off work. So that's why I didn't do Psych NP. When I did my rotation with Dr. Sachs in Novi, he was family and psych. And that's why I decided to do dual certification, because he was seeing psych patients and I loved it. So I came home and I called Purdue like, hey, I want to switch to psych. And they're like, well, you're almost done, so you might as well finish this and then come back for a year for psych. And so that's what I did and became dual certified. So that's how it happened. And but if I would have just did psych, then I would have definitely went back and got the DNP. But doing family, then psych, Capella, family, psych, no break, then I just got a little burnt out with school. But like I said, in the future, I'll go back. And so let's see so you have 10 weeks to complete each term is 10 weeks, and you have to go to full 10 weeks. So what I used to do is complete the assignment. You have some professors who let you complete the assignments and then submit them as soon as you get them done. You have some professors who say, no, you can't submit any assignments early. You have to do it, on schedule. And that's fine. But what I tell people is do the assignments early, save them, your assignments, and then when it comes to the week and it's time to submit your assignments, then submit your assignments. It's a way to get around everything. So the homework is like, the assignments are repetitive every week, the same, easy. Reese Peanut Butter Cup, what do you need the DMP for? So people can call you doctor. I don't know. I think it's a good thing if you're thinking of opening your own practice. It would be nice to have doctor in front of your name, even though at the end you're supposed to have NP or whatnot. You don't get paid any more money for your DMP unless you get a job promotion, but I don't know. The DMP is really, like I said, you have doctor in front of your name. And if you open your own business, it looks good to have doctor on your white coat. Or you can just get it to be so people can refer to you as doctor, but they already refer to you as doctor. So, and family and friends, you know, they a little disrespectful, so they probably won't call you doctor anyway. So, that's that. So the DMP is really like what I was leaning for. The reason I was leaning towards getting it is if I open my own practice. I think it'd be nice to have doctor on my white coat. Okay, because you deserve it. We work hard, too hard after all. These darn classes, you practically earn the title. Exactly. So they are, like when I go see members or whatnot, the pharmacist, when you call the pharmacy to order prescriptions or whatnot, they refer to you as doctor. We're all providers. We do the same thing that the family doctor do, no different. So if you didn't know, that's what the nurse practitioner and the PA, the physician's assistant does. Everything that the family doctor does. Everything. Everything. And everything. You just don't get paid what they get paid. And I'm not mad at it because they went to school longer and they did residency or whatnot. You know, it just was a shortage in physicians. So that's why they added the MP role to help out with the community, the people that needed help. So that's that. So, and those of you that missed it, I'm saying I had this from Purdue. I think it's a large or something. My cap and gown that I paid like $400 for when I thought I was going to go. I never opened it. I thought I was going to go to the graduation, so I purchased it. And I might do a giveaway. I mean, I will do a giveaway. I just have to figure out how I'm going to do it. So that's that. Any more questions? I really can't wait for this podcast. I have to learn how to edit stuff too. I don't know how to edit. Any more questions, guys? No. Nope. I think I answered all the questions. I would say that the program was easy for the family and psych. Psych was the work for psych was just doing the assessments on different people with different disorders, and you just say mental disorders, and you just do a assessment, and you talk about what you're going to prescribe and stuff like that. HPI, the CC. It was just easy. That was like every week in discussion boards, and It was easy. Now, I will say after you do the Excel portion with the F and P, even with the site, they have the nerves to have papers, 3, 4, 5-page papers. And I was the student who got A's and everything and did my calculation to see how many assignments I can miss and still get an A or a B out the class, because I wasn't writing papers anymore, and the nerves of them to ask for you to me to write a paper after I just did that accelerated 10 weeks in which it was all papers. How dare you ask me to write another paper? No, I will not. So you need 1,000 points to get an A. So that means I got 100 points I can jack off. So most of the papers are like 50 points. So skip one paper. You got to make sure you maintain a 100% in your other assignments, though, which is discussion boards. And don't worry about the quizzes and the midterm and final. The quizzes, they don't weigh much for your grade. I failed all my quizzes and still got an A or B out the class. But I figured I can jack off 100 points and still get B out the class and pass the class. So I'm not gonna lie, that's what I did, because I wasn't writing another paper. I'm sorry. So, and then as long as even if you get oh no, 900 points was still an A. 800 points was a B. So I could have jacked off 100 points and still got an A out the class. So that's what I was doing. So I didn't do any papers. Your authenticity and inspiration is amazing. Thank you. You're welcome. Nana loves Jesus. But so remember, if you guys if you want to skip some assignments, you got to make sure you keep an A. And remember, you need 800 points to pass. That is a B. And if you want an A, 900 points. So you have 100 points. I should be telling y'all that. But that's that. Everything Angie. What a nice name. How did you make it through 566 in the F&P program? I bombed the midterm. I cried. 566. What is 566? Is that fire? It's so much reading. Who read? Did you watch any of my videos? Girl, ain't nobody reading them chapters. Ain't nobody ain't no read no chapters. Ain't no bad no books. It's Google for that. But as far as the midterms and the final, the book that they recommend you get for that class, it's a what do you call it? Where you get all the answers. Answer key that you buy online from stores or something. But the only thing with that is you have to get STAHLS, I believe, for each chapter, it's like a whole lot of questions. So for your quizzes, you only have 5 questions. So you have to look through all these questions and answers, but you don't know which one's going to be on the exam. So I just said forget it, and I start winging it. I was just taking it. One week I get a 20%. One week I get a 40%. Sometimes I get lucky and get a 60%. But they don't have any weight on your grade. Now, the midterms, that's another reason you have to make sure you get A's, 100% in your classes, because you can do bad on a midterm and a final if you got 100% on your other exams, on your other assignments, and which you should. Discussion board, 566 is introductory to primary care. Okay. Yeah, when you're, so listen, here it goes. It goes like this. You have the discussion board. There's no reason you shouldn't get a 100% on your discussion board. You have an assignment. You have to aim to get 100% on your assignments. And usually you get 100% for just doing it. They're not hard assignments. You do the assignments and get 100%. You maintaining 100% on your in the class. The quizzes don't hold much weight. Then you get to the midterm and a final. If you got 100% in all the other classes, remember you have 1,000 points. So for the midterm, it's usually like what, 50 points, and then a final is 50 points. So that's 100 points. If you got freaking 100% in all your other assignments, you don't have to worry about getting a high grade on your midterm or final, because together they're worth 100 points. So you can fail them and still get an A out of the class. You understand what I'm saying? So maintain 100% on all your other assignments and or close to it. And then when you get to your 50-point midterm and your 50-point final, you have some room to play around, because that's 100 points. Introduction to primary care. I watching them now to find out what you did. Yeah. I had a 97 till I took the midterm. Now it's 89. Okay, you got a B. And that's another thing. Don't get stuck on trying to get A's. Get stuck on trying to pass. It's okay to get a B. It's okay to get a B. You're in your master's right now. So the only thing after that, like, you're not trying to get a certain GPA to get into another school. You're at your master's level right now. And your GPA is important, but it's not important enough where you have to focus on getting an A. You can get a B and be fine. So you'll probably go for the post-certificate, or you'll be done. So it's okay to get a B. Don't wreck your brain or stress yourself out. And at first I just wanted to get A's. And then I said, you know what? It's okay to get a couple B's, especially at this point. It's okay. So even for your DNP, I don't think they're going to say you need a 4.0 to get your DNP. So you're fine. So I had a 97 till I took the midterm. Now 89. I already at that. So that's fine. You're doing good. You're 1 point away from an A. Don't trip. Don't trip. All you need is 800 points to pass the class and move on. Anything else, guys? Anything else? I'm gonna get off so I can log in and do this read something about, you're welcome, everything Angie, so I can do some of this podcast work, watch some of these videos. But it's been real until next week. Oh, I picked up, how was the certification exam? Oh, certification exam. Oh, for the F and P. Oh, I did a video on that. I failed that one and passed it on I passed it on the 4th try. The first time I ever had any anxiety, test anxiety. It was weird. So after I failed it the third time, I talked to a therapist, or what was he? Psychologist. And he told me what to do to make sure I passed the 4th time. And it was weird because you could have asked me anything and I can tell you. You could have sent me any question and I could answer the question. But when it came to sitting in front of that test, and sitting in front of that computer, I couldn't get it done. So I took it 4 times. So, and it seemed so easy the 4th time. After I took the advice of the psychologist. And then for the Psych certification, it seemed easy. So yeah, and I passed that. I took that one twice, but the reason I took that one twice is because I forgot to cancel it, and so I forgot to reschedule it. I think most of us have those anxieties. Yeah. So the Psych, I forgot to reschedule because I wasn't able to test. Thank you, Sandra. Yes, I did do it. I wasn't able to I wasn't ready to test because I hadn't took a review class or anything, but I forgot to cancel, so I had to go take the exam. And rightfully so, I failed it. I knew I was going to fail it. But then I did a review, and then I went and took it, and I passed it with flying colors. I didn't have any issues with that. But I did a video where I talk about I failed the F and P 3 times. Exactly. I did a video about that, so you guys can watch that and see how I overcame that. Any more questions? Do I look sleepy? Yeah. I feel sleepy, but I got a couple things I have to do. That's it, you guys. No more questions. Thanks for sharing your night with us, Angela. You're welcome. I appreciate you guys too, also tuning in. You have a blessed night also, Sandra. Geriatric. Geriatric is just like, you have more options with family. You have more career options with family. With geriatric, you're just, even with family, you still can see geriatric patients. With the geriatric NP, you only see geriatric. Thank you, everything, Angela. Thank you, Sandra. You're a blessing, and I'm very proud of you. Thank you so much. my next live, that's what I was thinking of. Oh, I want to tell you guys. So with my other job that I do the health risk assessments televisit, and there was just too many cancellations. So I decided to do my second job, the home visits, Monday through Friday. So I'm trying to think, do I want to do it? I don't work on Sundays. Do I want to do it on Sunday? Or do I want to, I don't know. The only reason I was able to say every Tuesday at 9:30 is because I know I would be driving and I was able to jump on. But to do the lives like this and answer questions, it depends on what time I get off work. So, and the only reason I'm really still up is because Aiden don't have school tomorrow. So usually we'll be trying to get ready for bed on the weekdays. So, maybe I'll do it on Fridays. So maybe I'll do it on Fridays because Aiden don't have school on Saturday. So maybe I'll do it on so maybe I'll do it on Fridays. But what if I want to go do something on Friday night? That's the thing. So should I do it on Mondays? I don't know. Don't say that, Aiden, or I'm going to get very angry. Maybe, I don't want to say a day right now, but I will set, so make sure your notifications are on for when I go live or schedule a live, because I'll do it a couple days. I'll schedule it. Maybe I should just do it on Fridays. Should I just do it on Fridays? That's what I'm saying. Sunday. Well, Sunday evening. So Sunday, I like to after 6 p.m. I see it's a good turnout when I'm doing it after 6 p.m. So maybe I will. So this Sunday, okay, so I wouldn't do it this Sunday, or I might. I don't know. This Sunday I'm going to brunch with my sisters, so I might be a little tipsy on Sunday. Let's say, what y'all think about Sunday? Sunday, maybe like Sunday at maybe, if I want to get Aiden to bed at 8, 9 o'clock, maybe that's my goal.
I said, where's it? You got a can over it?
Yes, a white one. That's my goal. So maybe, yeah. So maybe Sundays at 7. Sundays at 7 p.m. That's what I'll do. Sundays at 7 p.m. Everybody be home. Everybody be home from church. Some people might be going to Bible study. People don't go to Bible study at 9 on a Sunday, do they?
Bible study on Sunday.
Oh, people don't go
For the
to.
record.
Some people do go to have Bible study on Sundays.
Ain't no Bible study on no Sunday.
Yes, it is.
No, they ain't.
Dante go to 2 services. Go to
That's not Bible study. That's how I know you keep talking little. That's not called Bible study.
No, he go to church, to the service in the morning, and then at nighttime.
Afternoon service. I know.
Well, maybe it's okay.
It's not called Bible. Look, you holier than.
That's what I'm saying. I just said people don't go to Bible. People don't have Bible study on Sundays. I said that.
That's why I'm gonna have a talk with you when you're done. 'Cause you be like,
Anyway, so
Lord.
Sundays at 7 p.m. I'm going to schedule my live. You can hear him? See, that's what I'm saying. They can hear you. Yeah, Sundays, I'll schedule it right now. That's elder service time. They got to pray extra. Okay. Okay. The weekends you work, you can listen while you're driving. Okay. So that's what I'll do. I'll set it right now. Let me see. Oh, this is cute. Let me see. Let me see how to do this. I'm just doing this just to do it. Sunday. At, bring it here. 7 p.
I'll wait till you get done.
Question mark.
Is there another piece to it?
That's funny. A lot of people logged off though. Good. I just did a poll. Because I thought that was cool. I should have been did this. Okay. We'll do Sunday at 7 p.m. If it doesn't work out, time frame, so you'll have enough time to put Aiden to bed. When Aiden go to bed, I want to go to bed. So I'm going to try to do it like 7, like do it for an hour. I'm going to narrow it down to an hour. So I can go to bed also. Aiden really ain't going to go to bed without me, to be honest. So, all right, I will talk to you guys Sunday. Oh, I'm tired. Yeah, he been tired. All right, guys. Thank you. Sounds like a plan. Thank you guys so much for tuning in. Thank you guys for subscribing. Thank you guys for following. Please share with your friends and family. Just pick 5 random people just to share it to somebody that should be going. Why is you looking at me like that? Somebody that you think. So I got people on here, on my subscribers, that told me like they were like 60, 70, wasn't thinking about going back to school, didn't think they can go back to school. And watching my Capella videos, they were able to do it. And watching my Purdue videos, it just motivated them to keep going. I have had some people talk about how they didn't even think, it wasn't even on their radar to go back to school. And somehow my page popped up and they just watched it, and I motivated them to go back to school. And they said they weren't researching any schools or anything. They just seen my videos and it motivated them to go back to school. And I love to hear testimonies like that. So share my videos with somebody that you think should be going back to school, who's been thinking about going back to school. And just to try to, let's motivate. All right, you guys have a good one. I am signing off.
Good night.
And again, Antoine said good night. Aiden, you saying good night?
Good night.
Aiden said good night. And you guys have a good one. Thank you. Good. God placed you here for a reason and a purpose. I know, right? That's what I'm thinking. So, podcast, why not? All right. You guys have a good night. See you guys Sunday. Sandra said good night, Aiden.
Good night.
Sandra, say good night, Sandra.
Good night, Sandra.
All right. Good night. Good night, Sandra. I am sleepy. I can't go to sleep. No, I'm not done, so don't say anything. Good night.